health service from this Tory government. And frankly, this is a man who's got a war on Wales and is using the Welsh NHS to make political propaganda. This is a man who has broken...
Order! Order. For the avoidance of doubt, however long it takes, the questions from the Leader of the Opposition will be heard, and so will the answers for the Prime Minister. That's the situation, and the sooner people learn that quite simple lesson, the better. Mr. Ed Miliband.
We know this Prime Minister is in a hole on the NHS, and this is all he can offer the British people. It's time we had some answers from him. Now, he's broken his promises on waiting times in A&E. He couldn't defend what he said about maternity and emergency services. Can he explain this morning why new guidance has been issued to some hospitals, making it harder for them to declare a major incident?
Let me answer that very directly. The NHS in the West Midlands, without any instruction from the Department of Health, without any instruction from ministers, issued a statement about major incidents. The head of NHS England was asked about it this morning, and she said this: "I haven't been under any political pressure. This document was issued in the West Midlands." What a contrast between the operational managers of the NHS and the man who wants to weaponise the NHS. Now, the Right Honourable Member, he mentioned Wales. He criticised me a moment ago for mentioning Wales. He seems to have forgotten that yesterday he said this to the BBC, and let me quote. He said this: "It is right to look at problems in Wales and to compare." That is what he said yesterday. Now, let's look at what's happened today in Wales. The Welsh ambulance service statistics have come out, and they are the worst ever on record. Just 42% of emergency calls are answered in time, compared with 70% in England. So will he now admit that Labour's catastrophic cuts and mismanagement in Wales have cost the NHS dear?
Mr. Speaker, the last time he was in charge in Wales, people were waiting 2 years for an operation. That is the comparison with what was happening. Now, everyone will have heard, he did not answer the question. He did not answer the question about what is happening in the NHS in England. This is what the head of operations at one NHS hospital says, and I quote: "This is the enhanced criteria that has been introduced by NHS England to stop trusts from calling a major incident. The whistleblower says the hospital's hands are being tied." Now, the Prime Minister says they're not. Who does he think people will believe?
People will believe the head of NHS England, who said this very clearly this morning: "Local hospitals continue to have responsibility for deciding whether to declare major incidents." It's perfectly clear what's happening, Mr. Speaker. He is clasping at straws because he's in a desperate mess on the NHS. He talks about Wales. Here's the record. Per head of the population, 10 times more people in Wales on a waiting list for an operation. Nearly twice as many ambulances failing to meet those urgent calls. Almost twice as many people waiting for more than 4 hours for A&E. That is what is happening in the NHS in Wales because Labour ministers cut its budget. But the reason he's in such a mess on the NHS is this. A week ago, the Shadow Chancellor said that every penny from their new homes tax would go into the NHS. Yesterday, the leader of the Labour Party said he had a plan to pay down the deficit with tax changes like the mansion tax we've announced. So there we have it. 99 days to go before the election, and they can't even have a sensible policy on the NHS. What a completely useless opposition.
99 days to kick out a Prime Minister who has broken all his promises on the National Health Service. And today's revelation shows once again the NHS under him is in crisis and under strain. It's a crisis of his making, on his watch, and that's why nobody will trust him with the NHS ever again.
What a contrast, Mr. Speaker. This government dealing with the unions to stop the action in the NHS. A Labour